Well, hello back again to everyone. It's already 5 minutes, so I do believe we can start now. Um, First of all, if you have seen the videos that I have uploaded yesterday for you, they are containing the part of the back, which I told you that I will upload. This is for the back muscles, as well as you could find there the part of the thorax, the both the skeletal portion as well as the muscular part of it. So, now what I want to go through is that, first of all, do you have any questions about the previous videos, the portion of the back, for example, or introductory part? Let's answer on the questions first, and then we can go through the new part, what I have uploaded for you, so to make it more understandable, more clear. And okay, first I am waiting for your questions here back in the. Mhm. Okay, Mohammed is asking us, the T1 and T4 vertebra share some features of cervical vertebrae. What are the resembling features of the T2, T3, T4? Okay, a good question. Thank you so much. So mainly when we're talking about the typical vertebra and comparing it to the typical vertebra, I do believe in the case of the thoracic, it's clear that it's one of the closest, let's say like that, to the typical vertebra. In the case of the thoracic ones, what they do have in the what they are sharing, let's say like that, in the case of the cervical ones, mainly it is closer to the C7 or the last cervical vertebra, where particularly, as you remember, we do have a slender type of the spinous process. An interesting thing that in the case of thoracic, most of them, as you know, in the case of the spinous process, they are oriented posteriorly and inferiorly, as you know, so they are inferiorly directed. Although this is gradually going through, if you will let me open the book, please, and show you what I mean. And let me share my screen first of all. Just a second, please. And I will show you what do I mean. Sorry. So where is our chapter 4? And here we do have the second. Yeah, I will just right now share my screen with all of you. Just a second, please. Good. Can you see my screen? Good. So particularly from this picture, it is nicely seen that when we're talking about the T1, do you see this part? Let me make it like that so I can see what you are commenting. So in this particular picture, you can see that on the posterior view as well as the lateral view, if you'll see the portion of a C7 here, yes, and then going down, you can see that still the part of the spinous process here is more oriented posteriorly rather than inferiorly compared to all of the others here. As a result, one of the as the according to the surface anatomy, normally we can how to say palpate the part of the seventh vertebra, particularly its spinous process on the back, simply, which we also call, as you know, the vertebra prominence. As a result, you can see that the T1 and T2 and T3, they are also sharing this particular characteristic of a spinous process, as well as what is interesting here is that in the case of C7, even the transverse processes are literally very long one. And as a result, compared to the parts of the T1 or T2, T3, they have some resemblance to each other, as well as even the part of the body of the vertebra. Now, why? Because first of all, the seventh vertebra is really much larger compared to all of the others, as you could see, for example, from this picture. Let me zoom it out, please. Yes, here it is. Yeah, here it is. Please, could you see? Can you see the part of the transverse processes? You can see that transverse processes are also mainly laterally oriented, as you can see, and as a result, these small resemblance are still seen here. Plus, the idea is that if you will compare the whole vertebral column, yes, starting from the first one going down towards the lumbar or towards the sacral, there is like gradual changes and gradual changes towards the particular characteristics, you know. Plus, in the case of the T1, to be honest, it is really very different, so we could say, from the other types of the vertebrae. And I said that in my last videos, particularly when I'm talking about the thorax. And why? Because if normally in most of the thoracic vertebrae, which you can see particularly here as the typical vertebrae of the thoracic region, you can see that we do have the demifacets for the articulation of the ribs, of the head of the ribs particularly. But for example, in the case of the T1, as well as also for T10, as well as also for T11 and 12, in this case, we do not have a classical representation of a demifacet. Here we do have the whole complete facet for the articulation of the head of the rib. So as a result, it's like a gradual conversion, let's like that, of the cervical vertebrae towards the thoracic one. Plus, you can see that all of the other cervicals are very different. Yes, they are particularly, their processes are really very different compared, for example, to the C7 itself. That's why even C7 is not the typical cervical vertebra. It is more look like the T1 or even T2 rather than the other cervical vertebrae. Plus, on the posterior surface, that's what you can also back again see here. Yeah, here it is. Let me make it bigger a little bit. Oh, sorry. Yeah, here it is. So what we can find here, that particularly compared to the whole rest of the vertebrae, you can see that particularly here we do have a foramens between the spinous processes. And this is interesting because the same thing we can also find in the case of a lumbar vertebrae. And by the way, for us, it's also having some clinical importance. And why? When we are particularly in diagnostics, so particularly when we are performing, and we do have here this picture, let me show you. When we are performing the puncture of the CSF, now what does it mean? Do you remember one of the main functions of the vertebral column was to house the spinal cord, one part of the CNS? Do you remember that? So housing of a spinal cord, literally, it's a soft tissue, simply to say. And this housing of a spinal cord means that also in surroundings we do have a fluid which we call the CSF, or cerebrospinal fluid. It's like the idea that the whole whole brain and the spinal cord, both of them, they are not just enclosed by the rigid material such as the bone, but also in between of the bone and the central nervous system itself, we do have the layers of a connective tissue where we have the fluid. So it's like, imagine that it's like floating in the large aquarium of the fluid, you know? So why I'm saying that? Because if we do have the different types of the inflammatory conditions, so literally because of the infectious, I don't know, for example, a part of a meningitis or encephalitis and so on. In this case, what do we have? Let me show you please this part. I do believe it was somewhere here, if I remember correctly. Just a second. Here we do have a nice clinical correlation for that. And this is the herniation. I've talked about that. Not this one, not this one. Just a second, please. We do have the puncture. We are performing the puncture to, let's like that, harvest the part of the CSF to make them to make the diagnostic tests. Although, let me show you how we perform it, if it is well seen here, and you will understand why I'm connecting it to that particular function. Just a second. Okay. It's in the last part. I just do not remember. Yes, here it is. Good. So because we are not covering this part as a part of the vertebral contents, as you can see here, and because of spinal cord and the brain, we are covering in the body systems too. But here, what I want to show you is the way how we are performing the puncture. We call it lumbar puncture. I do believe it's clear why from the name, because that's where the anatomically, the spinous processes of the lumbar vertebrae are horizontally oriented. As a result, we simply have, as you can see here very well, so we simply have the place or the space to insert the needle for the harvesting of a CSF. Although what is interesting, is also interesting, that when I was trying to find out what are other characteristics, for example, how we can perform it and so on, in the different textbooks, they are saying to us and guidelines that it can be performed at the level of the thoracic region, but only at more upper parts. And why? Because that's where we do have this horizontally localized or horizontally oriented type of the spinous processes, giving us simply the space to perform the puncture. In this case, it will be thoracic one, not a lumbar one, sure. You know, the same happens at the level of the cervical region. Just why we are not performing it there? Simply because there are a risk of more complications, because not only the anatomically that the spinous processes of the the lumbar vertebrae are vertically oriented is important here, but also that you can see that normally the spinal cord in adult anatomy is terminating somewhere at the level of the L1, L2, or in between of them. And the rest of the material which we see here, that's what we call the cauda equina. These are only the spinal nerves, which are elongated and they are still localized in the region of the vertebral canal, and they are leaving the vertebral canal at every and each of the level of the vertebra. So that's why normally we say that we have 31 pair of the spinal nerves. As a result, this type of the anatomical feature still gives us less complications, let's say like that, or risks for the complications when we are performing the lumbar puncture. You can see here that lumbar puncture here, what they show you is much more deep one, because in this case we are talking about the entrance through the dura mater and the portion of the arachnoid mater of the meninges, and as a result we are performing the much deeper type of the injection. In this case, we can also perform, you can see that we can also perform the epidural type of anesthesia, but the puncture will be less deep, so more superficial in this case. But in all of the cases, it is not in the close proximity to the central nervous system. So it is mainly in the proximity towards the spinal nerves. So as a result, in this case, this particular resemblance of the cervical and the thoracic region, I mean the upper part of the thoracic region, is still giving us some, let's say like that, freedom to perform the puncture for the cerebrospinal fluid. So as a result, what we saw right now, particularly on the posterior side. Okay, I will not go back because it was too many Yeah, here. So this particular picture is designating these openings, so literally foramens between the spinal processes. So that's why, sure, it has some resemblance, not that much, but still has some resemblance towards the cervical vertebrae. Any other questions? I'm sorry. Do you have any other questions? Or we can continue with a part of the muscles and then the thorax. Should we continue with the muscular portion of the back and then towards the thorax, or? Guys, can you hear me? So we can continue, Mohammed? Okay, thank you. So what I uploaded for you, this part of the muscular region of the back, many times you will see I said one important thing, that when we talk about the muscles of the back, we need to know that we are talking about the simply region, okay? And that not all of the muscles here, by their function, are really the muscles of the back. What does it mean? It's a little bit not understandable, but I will explain right now. Look, first of all, these are the exposed muscles of the back, for example, yes? So the idea, yes, localization here is the back, that's for sure. But what is the function in this case? Do all of them produce the movement of the vertebral column? That's the main question you need to ask when you are making a classification of the muscles of the back, you know? So as a result, the whole subdivision, the whole classification of the muscles of the back is divided into two parts. We say that we have, first of all, extrinsic muscles, so more outer one, more superficial one, and we do have deep or intrinsic muscles of the back. So as a result, what you see right now in front of you, mainly they show you the extrinsic muscles of the back. So outermost, underneath the skin and subcutaneous tissue. A good example, I even told you that also in my video, you can see here the part of a trapezius muscle, for example, or even the portion of a latissimus dorsi. Yes, sure, they are localized in the back. According to the localization, we say they're extrinsic muscles of the back, and that's correct to say. But according to the function, okay, they are not producing any movement or any action on the vertebral column. So the types of movement, because if you remember in the introductory part, we said, like, we have a different types of movement, and one of the most common was the flexion and extension and some part of the rotation, as you remember, yes? So we have the flexion, anterior, posterior extension. We also have some lateral flexion, if you remember, some rotation. So this particular movement of the vertebral column is mainly dependent on the intrinsic muscles of the back. That's why from a very beginning of your of this part here in the book, you can see that they directly subdivided into extrinsic and intrinsic. Although it doesn't mean that there are no more subdivisions. I want you to not to mix them simply, okay? I know it's a large amount of info, but it is, it has a logic simply. So as a result, if it's extrinsic one, it's already understandable that it doesn't move the part of a vertebral column. Imagine the vertebral column on the posterior side, and only the closest muscle to it, they are the ones which can have some action of the movement of the vertebral column, okay? And these are only the intrinsic muscles of the back. In the case of extrinsic, what we saw right now here we do have a part of a superficial muscles, as well as we do have the intermediate muscles. So they are subdivided even more into the layers. So when we talk about the superficial, what I showed you right now, for example, here, there were the part of the trapezius muscle. You can see the latissimus dorsi, very beautiful and large muscle here. The portion of the rhomboids you can see here, as well as the part, levator scapula, which is localized under the trapezius muscle. Okay. So as a result, these muscles are not moving the vertebral column. But instead of that, you will ask them what they do. Why do we have it there? In this case, we classify these muscles as the posterior axio-appendicular muscles, where the name axio-appendicular literally means that we have the attachment to the axial skeleton, and the second attachment will be on the appendicular skeleton. So simply the part of the proximal attachment, sure, proximal towards the midline, yes, towards the median plane. Do you remember this terminology? It's closer to the axial skeleton, and it's on the axial skeleton. In the case of the appendicular one, I do believe it's clear. In case of a distal attachment, it is on the appendicular skeleton. You can even see it from this particular picture simply. What do you see here? On the example of a trapezius muscle. On the example of trapezius muscle, you can see how it is attached to the spinous processes of the vertebrae, yes? Of the thoracic vertebrae, as well as the nuchal ligament here, even the part of the occipital bone of the cranium. So as a result, okay, from the proximal attachment, it's clear. But in the case of a distal attachment, you can see how it is inserting or distally attaching to the structure which we call scapula. And the scapula is not a part of the axial skeleton, yes? As you remember from the introductory part, scapula is a part of the shoulder girdle, or we also call it the pectoral girdle, simply. As a result, we have axio-appendicular muscles there. And as the result, coming back to the answer of the question, why they are there, what are they doing? So they are playing a role in the movement of the upper limb and stabilization of the shoulder girdle rather than the movement of the vertebral column itself. You see? So that's why, for now, we will forget about the extrinsic back muscles. Why? Because we will cover that in the upper limb region, okay? We will cover that as a part of the axio-appendicular muscles, particularly for the upper limb, where we will have the attachments to the axial skeleton as well as the appendicular one. A good example also is the latissimus dorsi, this large muscle. Can you see how wide is the proximal attachment here? Again, the spinous processes of the vertebrae, even the part of the sacral, posterior sacral surface, as well as the hip bone. And what is happening in this case? We do have now the attachment towards where? Towards the upper limb. It's not seen from that side because it's the back. But the interesting thing that latissimus dorsi is literally like surrounding the lateral surface of the body, as you can see, and distally attaches to the arm, to the bone of the arm, which we call humerus. And the interesting thing that, for example, latissimus dorsi we are using in a case of climbing. So when we are, for example, putting the, like during the climbing or during, for example, the pull-ups, in this case, mainly what do we have? We have the part of the latissimus dorsi which is moving, and not in case of the flexion and extension of the vertebral column or rotation of the vertebral column, or lateral flexion of the vertebral column, you see? So as a result, here we do have the next picture, which is more designating the type of the intrinsic muscles. You see how deeply they are localized? So now let's go through some terminology to understand what I'm talking about, because terminology is a little bit complex. It's not difficult, really, just complex a little bit. Look, we have extrinsic muscles. We forgot about them right now because we need only the intrinsic back muscles, yes? Because they are moving the back itself. So we also call them the back muscles proper, all right, or deep back muscles. So these intrinsic back muscles are subdivided into the layers. So it doesn't mean that they are localized on the same plane. So as a result, we can subdivide all of the intrinsic muscles or muscles back of the back proper into the three main sublayers. And these are superficial, these are intermediate, and a deep. Using the word superficial doesn't mean that it is literally superficial towards the skin and very close to it. No, But according to the layers, and it's better seen, let me show you it here. That's better to show you like that. Here's a nice picture of the cross section. As you can see, particularly at which region? You can already know it. The thoracic one, yes, we can see the rib, how it is attached to the part of the body and the transverse process. So what I want to show you here is that in this case, because it's the thoracic region, it's not seeing the superficial layer, and I will explain why, but it's still seeing the part of the intermediate layer. You see it is more superficially localized, and here you can see, so these are the erectospinae muscles, and here you can see deep layer of the intrinsic back muscles, which are particularly represented by the transversus spinalis muscles. You see? So as a result, let's go through every and each of these layers. What muscles do we have here, and how do they perform the movement? And what is interesting for us here, that in the case of the first layer, what we have, this particularly the splenius muscle, as you can see. So the splenius muscle is representing the superficial layer of intrinsic back muscles. You see? Yeah, it's a little bit a long sentence, but I do believe it's very clear, yeah? So in the case of the superficial layer, we have, to be honest, one muscle only. And although here it is seen very well in the details, but to understand it better, here is our splenius muscle, one side, on the right side, and on the left side. Do you see? This is the splenius muscle. And even the name of the splenius muscle is literally in Latin means a bandage. So do you see? It's like a bandage surrounding the superior part of the back. And as a result, this splenius has, according to its attachments, it should have the proximal attachment, yes, towards the median plane, and it should have the distal attachment. So because we're starting for the first time the muscular structures, you can find the information not only about the attachments, but as well as about the nerve supply and the main actions. You can see them here in the table, and as well as you can see that in the portion of the text. But I would like to ask you that I need only, in the body systems 1, I need only the portion of the attachments, proximal and distal one, as well as the main action. Because a nerve supply, it's a part of the plexuses, as well as the part of the peripheral nervous system, which we're covering in the body systems 2. So by the way, when you will be entering towards the body systems 2, you will recall the information about the different muscles, you know? Because why? When we'll talk about the somatic innervation, we'll talk about the voluntary innervation by the nerve fibers simply, and what type of nerves are giving the innervation to different muscles. Is it clear till now? Is everything? Do you have any questions? Or I can start with the explanation, yeah? Okay, so in this particular picture, you can see that the splenius muscle was subdivided into several parts, yeah? So particularly according to its distal attachment, what you can see here, here, and here, we subdivide the splenius muscle into 2 parts. And these are the splenius capitis, as you can see here, where the word capitis or caput means literally a head. And here you can see the portion of the splenius cervicis according to its attachment to the cervical region of the vertebrae. As a result, we can say that the whole splenius muscle, according to its distal attachment, is subdivided into 2 parts. And this is the splenius capitis and the splenius cervicis. Although in the case of its proximal attachment, it's really much easier to understand. And why? Because here you can see that the proximal attachment is literally coming towards the spinal processes of the vertebrae. But here comes the knowledge about the cervical vertebrae. Do you remember? Cervical vertebrae contain a very short and bifid type of the spinal processes. As a result, most commonly, they are not providing attachment to the muscles unless they are very deep type of muscles and very closely localized to the spinous processes. Okay? As a result, in the case of superficial muscle of the intrinsic region or intrinsic back muscles, such as splenius, will have the attachment to the spinous processes of the vertebrae, but starting from literally C7 only, as you can see. And as a result, going down towards approximately the half of the thoracic region. So approximately T6 or T5. So the spinous processes here are prominent and very long, and they have the ability to provide the proximal attachment. But now we'll ask the question, if it is going like according to that nice picture, look here, it is literally these structures of a splenius muscle is literally very long. And as you can see, it's very broad, attaching towards the cervical region even. And that's true. As a result, what do we have as the, what can we have as the attachment? If you remember, in the case of a vertebral column, when we're talking about the ligaments of the vertebral column, we said that there is a supraspinous ligament which starts at the level of a C7. The question was what we have upper, what we have superior to it. And that's where we said we have a very broad ligament, which we call the nuchal ligament, particularly which was covering and attaching all of the spinous processes of the cervical vertebra. Sure, I'm not talking about the C1, because we remember that there is no spinous process at all. There is just a tubercle, although still it was covering all of these structures. And as a result, we even said that previously that nuchal ligament can be giving us the, or providing us the attachment, yes, to the muscles. And here, the splenius muscle is one of the best examples. So as a result, we can say as a summary that in the case of a splenius muscle, it will be both cavities or cervices. In this case, it will be attached to the spinous processes of a C7 to approximately T6, as well as the nuchal ligament at the level of a cervical region. Yes, continuing with the distal attachment, that's here comes the most interesting part, because in this case we do have two portions or two parts, let's say like that, and these are a splenius capitis and the splenius cervicis. So in the case of a splenius capitis, which is sure more superiorly localized, as you can see here, sure it will be attaching towards the region of the head. But what do we have here in the case of the cranium? Although we didn't cover that yet, the cranium, but we can know that mainly the portion of the cranium with the neurocranium. What does it mean? Let me show you, please, just to make it easier to understand and to remember, okay? Not just to memorize. I don't like when people are just like that, memorizing everything without understanding. I want you to understand. Yes, here it is, a very nice picture which designates the part of the head, just to understand what I'm talking about. I'm not saying that I'm explaining the portion of the head. It's not the part of the syllabus right now. It will be at the end of the semester. So what do we have in this region? So this is picture B, a nice representation of the two parts of a cranium, where we do have at the region of the face mainly, we do have the part of the viscerocranium, where we have an oral cavity, where we do have a nasal cavity, for example, as well as a part of the orbits, where the simply the eyes or eyeballs are localized. But you see the superior and posteriorly to it, we do have the region which we call neurocranium. And I do believe it's clear why we call it like that, yes? Because here we do have one of the important function of it to house the brain, the part of the central nervous system, as it was in the case of a vertebral column simply. So why I'm saying all of this back again, I mean in the parts of the how do we call them, in the parts of the head, I just want to show you the structure. Why? Because here you can see that most of the neurocranium is literally composed of the flat type of bones, first of all. And these flat bones are representing like a frontal one, you can see here in a greenish color, as the example here. You can see the part of parietal one, which is in the case of the, I don't know what color is that. It's like, what color is that? A red one. So here you can see the portion of the occipital bone, by the way, with the nuchal line where we had the attachment. And here comes the portion of the temporal bone, as you can see, this one in the orange color. And what is important here, that on the posterior side of the temporal bone, we have the structure which we call the projection, which we call the mastoid process of the temporal bone. So why I said all of these blah, 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 simply to understand the attachment of the muscle, which we call splenius capitis, particularly subdivision of the splenius muscle, splenius capitis. And here comes the idea about the attachment of the splenius capitis to the part of the temporal bone, particularly its mastoid process, as you have seen already. So mainly that's here we do have the attachment, as well as the part of the occipital bone even. Here, as you can see, mainly the lateral 1/3 of the occipital bone here is also providing the attachment to the splenius capitis. And the name now that it is splenius capitis, because the capitis literally means that it's designating to the attachment to the head, is literally very logical. Vice versa happens in the case of a splenius cervicis. So why? Because here we do have the part of the transverse processes of the cervical vertebrae. Most commonly it is C1, C2, C3, sometimes also C4 is as the part of the attachment, or place of the attachment of the splenius cervicis muscle. Now imagine, what do we have here? Imagine that these two muscles, when they are acting, imagine that both of them are contracting. We say bilaterally or together on both of the sides, simply. So imagine that they are contracting. What they will be doing, what do you think? They will be pulling the whole head as well as the cervical region, where? Posteriorly, yes, towards their proximal attachments. And what is happening in this case? What type of the movement we can have in this region? It's the posterior region. Yes. As a result, what type of movement we had here? What do we remember? Sorry, you're writing something I couldn't see. I'm sorry. Flexion, posteriorly. Let's think logically here. What was the posterior type of the movement? I mean, posteriorly oriented. Always. Posterior oriented movement was extension, I do believe, yes? So when we are performing both of them together, I mean, on both of the sides, bilaterally, these muscles are contracting on both of the sides, and both of them are pulling the head and the neck posteriorly. So what type of movement do we have? Can you do it yourself also? This is extension, yes? So as a result, when we talk about the movement bilaterally, so together, both of them, in this case, it will give us extension. But in case of the unilateral contraction, so when only one side, only on the right side or only on the left side, we do have the contraction of the muscle, then sure, it will be pulling the head where? Either, so on the side of the contraction, yes? So ipsilaterally, do you remember? So meaning that, in this case, yes, I agree with you. We will have the lateral contraction. So, the lateral flexion. So as a result, you can see that this type of a muscle simply gives us two things. This is if it's acting together or bilaterally, then I have the extension of the head and the neck. But if it is moving unilaterally, so I mean it only contracts on one side, so we will have the lateral flexion. I agree with you. You see the idea? So it's always, if you understand the proximal and the distal attachment, yes, and when you see how the fibers of the muscles are directed, it's always then easy to imagine what can be the movement or what can be the action in this case, yes? So where this muscle during the contraction will be pulling this everything. Is that part clear? So that's how it works, you see? So this was particularly for the, look, superficial layer of the intrinsic back muscles. Here we have only one muscle, one nice muscle, which we call the splenius. So the next type of muscles, what we have here, this is particularly the intermediate layer. So they are localized underneath the splenius one. And here particularly we call it the whole group of, it's a group of 3 muscles, to be honest, and together we call it the erector spinae muscle, or muscles, correctly to say in the plural form. So why? Because from the name it's already clear that these are the muscles which are together performing the standing position. Yes, so they are the ones which are helping us to extend the whole vertebral column, okay, during standing, during sitting, doesn't matter in this case. I mean, in the sitting position or in the standing position, doesn't matter. An important thing, they are helping to extend the vertebral column from the flexed position. So when we're flexing, so to, for example, to get something from the floor, yes, and then we are extending. In this case, the erector spinae muscles are helping us to do that, and this is particularly the intermediate layer of the intrinsic back muscles. So in this case, what do we have? What is the main subdivision and how this is happening? If we said that this is erector spinae muscle, so on the whole spine, on the whole vertebral column, it has particular influence. It means that this muscle group should be very long, so it is literally longitudinally and the vertically oriented type of muscles. And that's what you can see particularly from this picture. So you can see that one of them, the most laterally localized, this is the iliocostalis muscle. What is the name of iliocostalis? It's also very clear. You can see that its origin or proximal attachment is literally at the level of the ilium of the hip bone, as well as the part of the sacrum, posterior surface of the sacrum. In case of why costalis, because iliocostalis, you can see that it is directly associated with the ribs, particularly closer to the angle of the ribs, as you can see here, you know. So as a result, it's most lateral part. Here, the second one is the longissimus. So also, I do believe very clear to understand that it is starting from the lowermost or inferiormost parts, such as sacrum, and again, the part of the ilium, and is ascending now more medially compared to the iliocostalis, as you can see, ascending towards the thoracic region, towards the cervical region, and in comparison with the iliocostalis, which is literally, you can see, can reach mainly the cervical parts. Here it is even attached to the mastoid process of the again of the temporal bone. So as a result, you see that how from the inferiormost point of the vertebral column, it goes up or ascends towards the superiormost and even attaches to the part of the head. And the third one, the last one, but not least here, this is the spinalis. I do believe the name is also very clear why we call it spinalis. You see how it is mainly associated with the vertebral column rather than any other parts, yes? So as a result, this part or this subdivision, let's like that, that's what we call a spinalis muscle. Now, what is more interesting, as it was in the case of the splenius muscle, as you can see here, according to its distal attachment, in the part of the erector spinae, all of them, we can also subdivide them according to their attachments according to their distal attachments. What does it mean, you will ask? Simply, as you can see, most of them, even including the spinalis, to be honest, have approximately the same proximal attachment. So their origin is inferiorly localized at the level of the sacrum, posterior surface of the sacrum, as you can see, the part of the ilium of the hip bone, and particularly here you can see that ilium contains the projected structure which we call iliac crest. So posterior part of the iliac crest even gives the attachment to the erector spinae muscles, simply. And in the case of the longissimus, you can see the same. Just in the case of a spinalis, it also has the attachment to the lumbar region, particularly to the spinous processes of the lumbar region, as you can see here. So all of them together are attached. Like, imagine that every and each muscle, small muscle, has its own tendon, and they are like blended into each other, you know, and it's very difficult to simply separate them. That's why we say that the proximal attachment is literally not the same, but is shared by all of these three parts or through all of these three muscles in the group of the erector spinae. Okay, but then according to their attachment here, in the case of the distal one, you can see that there is the attachment of the iliocostalis towards the lumbar vertebrae, particularly their transverse processes. You can see that here it is attached to, as we already said, to the part of the ribs, particularly to the angle of the ribs. And here we do have a part of the transverse processes of the cervical vertebrae. As a result, according to the distal attachment, we can subdivide these muscles into several parts. And we can say that we have iliocostalis lumborum. So as you can see here, even we have here a nice designation of that. Iliocostalis thoracis and the iliocostalis cervicis, according to where we do have the distal attachment. The same happens for the longissimus, although compared to the iliocostalis, which is much lower in this case and has the lumborum part, in the case of longissimus as well as the spinalis, you will not find the lumborum. Although in their case, you can find the thoracis, longissimus thoracis, as well as the spinalis thoracis. You can find longissimus, although it's not seen here, but you can find the longissimus cervicis, as well as the spinalis cervicis. And you can find the longissimus capitis as well as the spinalis capitis, which are associated with the head region. You see? So as a result, you can see that this distal attachment is making some subdivision, although all of them together are simply important action. What they do, they are exerting their action on the vertebral column. So as a result, we do have here the type of the movement, which we call extension simply. Okay, so the attachments, I need from you all of the attachments here, to be honest, because when today I will release the topics for the midterm one, I've talked to the, I do believe it's here, just a second. Yeah, here it is. You can see them. Oh, sorry. You can see them. This is for my portion. And I will also continue to write down about what a professor of histology told me. So you can see that we'll go through the introduction of the clinically oriented anatomy. I will do it to PDF and we'll upload it. You see that we'll talk about the back, the portion of the thorax, and as well as we will talk about upper limb, particularly the bones of the upper limb, as well as the joints of the upper limb, as you can see here. So mainly this will be a part of the anatomy, which will be in your first midterm. And the histology, she already sent to me what will be your main topics, and I will upload them together. So you see, this part is important for me. What type of questions I can ask you? Simply the attachments, simply the actions, and so on. Okay, so will be proximal, distal attachment, literally any of them I can simply use for the questions, for the tests simply. Next Thursday, to be honest, I have the idea to bring some questions, okay, which we can work here on. These questions are similar, sure, not the same as the midterm, but you will see the style of the questions, let's say like that, and we can test what do we remember, what we don't remember, from what side we need the explanation more, and so on. Okay, so to go through, I just want to show you different types of muscles. I will come back to that one. Why? I will explain. Because here we do have the deep layer of the intrinsic back muscles, which is mainly represented by the three muscles in one group, which we call the transversospinalis. I do believe from the name transversospinalis, it's already clear that most of these muscles will be oriented, if not directly horizontally, in the transverse plane, yes? But obliquely and not that vertically as, for example, erector spinae muscle was, okay? And here you again have this cross section showing you the part of the intermediate structures. Here in this I don't know, bluish or turquoise color, you can see the muscles, which are, although the back muscles, but they are not the back muscles proper. You see, for example, this latissimus dorsi, the part of a trapezius, how they're localized. Also serratus posterior. In the case of serratus posterior, it's a part of the thoracic region rather than the part of the back, although just literally posterior localized. That's why it's seen there. So you can see how they are covering, let's say like that, the portion of the erector spinae as well as the transversospinalis muscles. That's why they are classified as the extrinsic muscles of the back rather than intrinsic muscles of the back, okay? So to continue with the transversospinalis, you can see that here we have only 3 type of the muscles, and the outermost, which you see here, this is the part of a semispinalis. The second one you can see here is the multifidus muscle, and the last one but not least, this is the rotatorus muscle. According to the cross section, you can see that the rotatorus are the closest to the vertebral column in the case, or deepest in the case of the vertebral column. Here you can see the part of the multifidus, the second. Have rotatorus longus and rotatorus brevis. So, and as a result, you can see, hello, can you hear me? Can you hear me again? Hello, can you hear me now? Yes. Looks like that there was something stuck, yeah? That you couldn't hear me. Okay, so what I was talking about was the idea of the multifidus and the rotatorus muscles, and what is interesting in this case that the rotatorus, although they are very, very small and very closely and deeply associated with the vertebral column, we still have subdivision there according to the length. So we do have a rotatorus longus, and we do have rotatorus brevis muscles. And where longus, I do believe it's clear, stands for the longer ones, and the brevis stands for the shorter ones. So as a result, you can see a very good example. So let's talk about this picture more. You can see the vertebral column, particularly here. You can see the part of the spinal cord, by the way, how it is housed by the vertebral canal, simply. And what do we have in this case is particularly the rotatorus muscles. You see, rotatorus longus, the longer one, and a very small one, which we call the rotatorus brevis. So in case of both the multifidus and the part of the and the part, so you can see them here, and the part, so this is the whole multifidus, how it is ascending on the vertebral column. So what is interesting in this case is attachments are mainly transversus spinalis, not present. Oh, sorry, that's my bad, my bad. Good. I do believe now it is presenting. So what I was saying is that, sorry, please. In the case of
Hello, dear students. Lina ma'am have internet problem, so you will have this lecture on a Saturday. We will inform you and we will send you the email. Sorry for this.